All right, well, it's just past the top of the hour, and we are going to get started. Before I hand it over to our moderator, I do want to let you know that all of your audio and video has been muted and turned off. If you would like to communicate with any of the panel, please feel free to enter into the chat screen where you can interact with them there. Please note that there are no CEs available for this session this evening. However, we are going to be providing an updated version a couple months down the road with some new exciting cases that we will have CEs for then. But in the meantime, we have a great session. And with that, I'm going to hand it over to you, Dr. Weiner. Thanks so much, everyone, for joining.
Well, thank you, Kate. Thanks for inviting me. We have a couple special guests today. Dean, can you advance the slides for me? So a little bit about me. I'm a facial plastic surgeon. I started using EO2 during the COVID era. And I was having to bring it to aesthetics for the main purpose of treating vascular occlusion, the healing aspect after having vascular occlusion. We're going to have a case study about that with Rechelle a little bit later. But I'll also go into the benefits and of EO2 versus HBO after the presenters. So let me introduce the first presenter, who is Dr. Stephen Beals. He's a cosmetic, plastic, and reconstructive specialist certified by the American Board of Plastic Surgery. He entered the field in the 1980s. He has an affinity for facial anatomy. He founded the Craniofacial Foundation of Arizona and the Barrow Children's Cleft and Craniofacial Center. His patients will tell you that he is an honest, kind, and very talented man who wants nothing but the best for them. He believes in providing an optimal environment for wound healing and recovery. He has been using EO2 for about 5 years on wounds from surgery and recently started clinical trials on laser patients. Rechelle Trejo, she is a graduate from ASU School of Nursing in 2003, and ever since then, she has been specialized in aesthetic treatments. She is currently attending the University of Phoenix to get her master's in nursing and become a nurse practitioner. She's a national aesthetic trainer for both Galderma and Allergan, the top 2 pharmaceutical companies in the US for aesthetics. Rachel founded the Oral Aesthetics in 2020 to create an innovative space where non-surgical treatments are prioritized. So now I'm going to turn it over to Dr. Beal, and he's going to go over his cases of using it for laser and a little background on EO2 as well.
Yeah, okay. Thank you, Dr. Weiner, and thank you for inviting me. And I'm looking forward to the evening here as we go over this topic. It's one of the best things that's been added to my practice in the last 5 years. I'd like to share some of that today. We're going to look at some of the science behind continuous diffusion of oxygen therapy, review some cases, and look at some new ideas on its possible use in laser as well as in vascular occlusion. We all know quite well how important oxygen is for us, and in the normal amount that we just get from the atmosphere in a normal healthy person, it's enough to heal a typical average wound. However, especially in plastic surgery, when we're moving tissue around and we create flaps, we've separated a lot of the tissue to move the tissue, to move the flap, and we rely on the remaining attachments for robust circulation, which doesn't always work out. And as sometimes circulation could fail, then the oxygen goes down and we start to lose tissue. So wouldn't it be great if you could have a way to concentrate oxygen in those wounds and actually supercharge the whole healing situation, like you can see at the top of this gradient here. The oxygen concentration and being able to improve the oxygen in these situations increases cell metabolism and energy production. It increases the rate of reepithelialization up to 70%. It increases collagen synthesis and tensile strength. in all of its aspect, the deposition, the collagen remodeling, the tensile strength. It increases antibacterial activities, and it supercharges the angiogenesis process, which is what healing is all about. So the oxygen in a wound, concentrated on a wound, is able to diffuse through the surface of the wound and into the surrounding tissue where the hemoglobin is, and it can attach to the hemoglobin and do its thing. So it's just like the situation in the lung with the alveoli. There's an interface there where oxygen and hemoglobin get together. This is the system that I'm using, the OxyGeni system. And the little generator that's there is the fuel cell that creates the oxygen in a concentration of up to 99.99%. The bandage then is a specialized bandage that allows the oxygen to completely diffuse evenly, and it's delivered by that tubing. That little machine is about the size of a cell phone. It's easy to wear on a little belt or pack, and the patient will wear it as long as they are needing it for their wound situation. So what are the indications for continuous diffusion of oxygen? And I've listed some here that come to me as a plastic surgeon. And first of all, it's really all surgical wounds would benefit from it, even just linear incisions. Certainly wounds at risk, like flaps, that have a chance of struggling with their circulation, and then outright wounds that have occurred because of loss of circulation or dehiscence or trauma. And then the last subject that we'll talk about is its promising use in laser resurfacing. So the in use on incision lines in the ordinary simple linear incision, the patient benefits from scar reduction and surprisingly pain reduction, and increased chance of positive outcome, and just an accelerated healing process. This the very interesting study that I came across that is from the Baylor College of Medicine, and the authors looked at the effectiveness of CDO as an adjunct to therapy to improve scar reduction after anterior neck surgery. They looked at patients that were having routine thyroidectomy and parathyroidectomy surgery, so they had a linear lower neck transverse wound. They had 12 patients in a control group and then 9 patients in an intervention group. And they used EO2 on the wound for 24 hours a day for 4 weeks. And they looked at scar length and oxygen saturation. In the lower right-hand corner, they use this little device called the Kent imaging system to actually get a visual of the oxygen saturation percentages. And you can see that it's really significantly improved by this topical application of oxygen. So their results were statistically improved scar length and significantly improved oxygenation of the tissue. So in what I call the struggling wound, this is a patient that had a mastopexy, and at the end of the flap, where the circulation is always the most suspect or compromised, she did have some marginal necrosis along that vertical line that you see there in the upper left-hand corner. We applied the EO2, and the picture in the upper right-hand corner is 2 weeks later, and in the lower left-hand corner is 4 weeks later. And then that nice, clean, granulating, healthy wound was good enough then to go back to surgery and do a secondary closure, as you see in the lower right-hand corner. That was six weeks after the secondary closure. The second case here is a wound dehiscence about 5 weeks after a mastopexy. You see in the upper left-hand corner, and in the upper right-hand corner, this is 11 days after EO2. The left lower corner is 18 days, and then the right lower corner is about 6 weeks after EO2. You can see how it's healed so nicely there. So in the laser resurfacing field, it's really incredibly popular now. Over 2 million cases are being performed per year in the United States, both ablative and non-ablative. And it has great benefit, and it also can have complications that include redness, swelling, itching, and pain. That's really more of a side effect, I guess. Infection can occur, bacterial, viral, or fungal infection, changes in skin color like hyper or hypopigmentation, unfavorable scarring. All these are potential complications of laser resurfacing. I'm going to go back here. Yeah, so the procedure is done depending on how aggressive or deep the settings are, either under topical anesthesia, local, or sometimes with some oral sedation and nitrous oxide using a Zimmer air cooling device. And then sometimes I perform the laser resurfacing in the operating room under general anesthesia if I'm there anyway to do a surgery. So the typical care for that would be cleansing twice a day with a vinegar, water, Aquaphor application, use of antibiotics, antifungal and antiviral. And it takes about 5 to 7 days for that process to play out and for the peel to be finished. There's a fair amount of pain with it, especially in the first evening. So about 5 years ago, with Dean here in Phoenix, we did a qualitative study on a few patients just as a pilot. And we took a patient with a full face laser resurfacing, and we applied EO2 to the right lower face, roughly the mandible area. And we could see right away that there was a benefit here of diminished pain or no pain and accelerated healing compared to the rest of the face. So in a more structured and studied fashion, we repeated that study on 10 patients just recently. They all had full face laser resurfacing, and then half of the forehead had EO2 applied to it. The side, that is the right or the left, was chosen at random, so the raters would not know which side was treated. This was applied continuously for 96 hours or 4 days. And the rest of the face was treated in the usual manner with cleansing and Aquaphor. Photos were taken periodically, and then the raters scored the photos on several characteristics of the forehead and the amount of redness, et cetera. And then the code was broken, and we could see, which side was treated with EO2 and which side was treated with the standard fashion. So one thing we found on everybody is that there was significant pain relief. Essentially, 100% of the patients had, they said, no pain over the area of the EO2. And we also then saw, and I'll show you an example here in a second, that the healing was faster on the treated side with EO2, and was fairly obvious to the raters as they rated and evaluated all the photos at every stage of healing. This is one patient in the upper row there. You see day 0 before the laser resurfacing. The middle row is day 2. You don't see a whole lot of difference there. And then day 4, you can already see that the right side of the forehead was treated with EO2 and is far ahead in its healing from the left side that was not treated. So we feel that there is a great benefit to using EO2 in the routine laser cases, and are in the process of developing a way to really apply this to the entire face. And hopefully that will make the experience easier, less painful, and quicker healing, less downtime, fewer complications is what our hope is in the future as we continue to follow this out. Dr. Weiner, do you have anything to add to that?
Okay. That's beautiful. I would like to ask you, because if you put anything that's ointment based on the skin that inhibits the oxygen from getting through to the tissues, do you put anything between the dressing and the skin? Any hydrogel or just straight on dressing?
Yeah, so what we did for the study, we initially, the first dressing, we didn't, because there is a reasonable amount of exudate you get in the first 24 hours or so. After that, because the dressing is a highly that we were using is highly absorbent, we put an aqua gel on the tissue to make sure that it was moist and didn't dry out too much.
You know, I'm getting into the exosome craze, and I believe that exosomes topically on that wound in combo would probably even do better. And we're doing that for vascular occlusions now. And I think that the future of vascular occlusions is EO2 and exosomes and much less Hylenex, because we're treating a wound now and we don't need to over treat it with Hylenex. So that I think that's the future. That's beautiful. And so do you actually have a handle on what you think there was a difference in healing as far as days go? Was there like two or three fewer days of healing, or do you have any idea?
Yeah, I think that they by day 4 or even day 3 were way, 2 or 3 days ahead of schedule. So I think they would have less downtime. And I agree with you on the exosomes. I think they're terrific, and I use them on those breast wounds along with EO2, as well as I'm using it on laser as well as with needling.
Yeah.
So yeah, I agree. That's definitely the future, and hopefully we can make this a better experience.
Yeah, I think the apprehension of people undergoing the CO2 is the terrible pictures that you used to see with crusting and wound care, and they just, so if we can do anything that shortens that time, improves the pain, it's a no-brainer, right?
Absolutely.
Yeah.
Absolutely. And I think it's also, this probably will come up in question and answer, but I think it's very affordable. It's an easy call to add that to the regimen.
Yeah, exactly. That is definitely part of its benefit. Now, I did send some people to HBO, and we'll get into the pluses and minuses of that, but that's a whole different level of cost and pain in the butt too, traveling and all that when you have a wound.
Exactly.
So are you complete with your presentation?
Yes, I am.
Okay, so we'll turn it over to Rechelle now, and then we'll bring everyone back on after her presentation.
All right, thank you so much, Dr. Weiner. So good to see you again.
Hello.
Okay, let me see if I can get control of my screen here. All right, so my little family, this will become important later on when I talk about my personal surgeries and what I had done. So I had 5 children, and my last 2 are twins. So they were the bonus caboose there at the end. Let's see here. There we go. So one of the things I learned early on in my injecting experience, I did not have Instagram when I first started injecting. I've been injecting over 10 years now. But a lot of times when you take that initial injector course, so I'll be speaking first from an injector's experience. At least the course I took was a national certification course. I was not taught complication management. That wasn't something that was ever even taught to me, how to handle a vascular occlusion, how to handle complications when they came up. And so we come out of those initial courses and we have all of this knowledge of how to inject, and yet no knowledge on how to handle any of the complications that come with it. And it wasn't until years later that I realized, okay, wait, if I'm going to be offering these services, I should probably know how to handle complications that come with it. And so it was an opportunity that I had to go and train with Rhonda Kennelly in Chicago and do her safety course. And it was specifically based around complication management. And I learned so much from that. Medical journals, attending aesthetic conferences, and was able to really get a firm understanding on what was happening and how to watch for things. So that way, when they did come up, I was aware of them. So brief picture here on just the stages of what a vascular occlusion is. So vascular occlusion would be when the blood flow is restricted or cut off to an area, causing that hypoxic tissue. And so the tissue is dying, essentially. It's not getting the blood flow and the oxygenation that it needs. So initially it's the blanching, and then it goes into a reticulated stage. You get the inflammatory, which will show up often as little pustules, then a coagulative stage, and then it starts to slough and repair at that point. So this was our patient that we had. Actually, it was just over a year ago now. She was injected in the cheek with needle by one of my colleagues. And luckily, the injector who injected, she recognized the vascular occlusion before the patient even left. So if you look on the picture on the right there, her left cheek, you can start to see that little subtle blanching on that right cheek. And so she immediately dosed with Hylenex. And we used a lot. So Dr. Weiner talked about being able to use less Hylenex to dissolve, but we used it a lot initially. So we did our protocol, which was dosing with 4 boxes, hot compresses, massage. She was already on a blood thinner, so we didn't choose to give her aspirin. We notified our physician, our medical director, and then we continued to do more Hylenex. I'm trying to remember if the video works. Yes, it does. Okay, so we had ultrasound come in. Dr. Weiner has a phenomenal ultrasound course that we need to get him out to train our office, but the ultrasound technician, or the girl who had ultrasound, didn't know how to use her ultrasound device. And so she had this amazing paperweight, essentially, because she didn't know how to use it. But we were grateful for her to at least be willing to come out. We tried to figure out what the blockage was. We couldn't. We dosed with more Hylenex, continued to do that. We discussed hyperbaric oxygen. However, we were not able to get in because, of course, these things always like to happen on a Friday night, and it was unable to get her in anywhere. Day 2 post-injection, she returned again. Let's see if I can get the video. She still had a little bit of delayed capillary refill, especially along her nose areas where we were really seeing that. And so we dosed her again with some more Hylenex that next day. So we did another 2 rounds of 600 and then another 300 units. And then again, attempted to get her into hyperbaric oxygen. So we were very fortunate that this weekend happened to coincide with Dr. Weiner and Dr. Surek's cadaver course. And they were in Phoenix, and we were attending that cadaver course that weekend. And so we consulted with them, and Dr. Weiner was very helpful in that moment. He actually, during the conference, we were talking about vascular occlusion complication management. And he was sitting on the stage and discussing it, and I was in the back. And we had already previously talked about it. And so he was up there and he said, you know, we don't have a lot of experience with this yet. We don't know if CDO is really effective, but there is this company called EO2, and it may be beneficial if you end up having a vascular occlusion. So I'm sitting in the back and I'm literally on my phone writing, looking it up and figuring out what in the world the EO2 is. And I step out of the conference and I go make that phone call right then. And it was Sunday, so obviously EO2 was closed, but left a message. And first thing on Monday morning, I get a call from EO2. And so this was that Sunday night. She sent us this picture. So now we're seeing that inflammatory process. You can see those little pustules there, but you can see that her capillary refill here is definitely better. So we know at this point that the vascular occlusion, the occlusion of that artery has improved, that the blood flow was returned. So now it was wound management. How are we going to help this patient? We did give her another 300 units of Hylenex. Honestly, I don't think it was necessary at that point. We started her on antibiotics, and we did topical bacitracin at that point. And this is where Dr. Weiner was teaching us all about EO2, and not, like I said, not really having a whole lot of experience with it, but mentioning it, and I was ready and I was on board. So Monday, actually this was Tuesday, because we called Monday, they shipped it to us Tuesday. And so we were able to get it on her Tuesday. You can see her skin there. There's bruising. There's definitely some scabbing. She had the bacitracin ointment on it. And so we started the EO2 that day. This is her wearing the dressing. I will say it's a little bit awkward on the face. We found that the Tegaderm does not work very well, so we use paper tape. It is a little bit awkward, but I will say as well, for me, there was comfort in knowing that it's still small amounts. We did the 15 mLs of oxygen, and so I wasn't worried about her being hyperoxygenated that close to her nose and mouth. If you had something that had a lot of oxygen being diffused to the area, I'd be worried about too much oxygen in her system. That was 24 hours after. To me, the healing was incredible. Oh, sorry, my light just turned off. I got to move in my office here. The healing was absolutely incredible. And we were able to see enormous benefit from that. There was definitely a decrease in the bruising as well. So this was 9 days post, complete tissue healing. She had a tiny little pimple that was maybe a little infection, little something that was starting to come out, but major improvement. The erythema had lessened, the bruising had completely subsided, no tenderness, no pain. That was the other thing that she did mention, is before EO2, it was uncomfortable. It was tender, it hurt. Once she started the EO2, she didn't complain of pain at all anymore. She didn't say there was any pain associated with us whatsoever. So I'm going to put this side by side. So these are 9 days post vascular occlusion on 2 patients. One without any EO2, any CDO therapy, and the other one with. To me, that is a powerful side-by-side picture of the difference in a very similar vascular occlusion presentation, the same area, even same side of the face, and the healing of those two is completely remarkably different. So 4 months later, this patient, we made sure that we took care of her. So we did microneedling, medical grade skincare. We added an additional 4 syringes of derma filler, which originally she couldn't afford. She was able to only afford 2. So she said that although having a vascular occlusion wasn't her ideal way of getting wedding ready, that she was grateful to be able to have had the experience to be able to have full, complete results. So that was nice. And this is just a screen just showing different things. Dr. Weiner actually did a Instagram live on this as well. And different things. Okay, I'm gonna skip ahead. Okay, so then my own surgery. So I actually had 2 surgeries this last year. I underwent 2 elective surgeries. I had a lateral brow lift that I had done, and I chose to make EO2 a part of my recovery program. So both physicians, I went to 2 different physicians. They were not opposed to me using CDO therapy. They just didn't necessarily buy into it either. And so it was fun to be able to do it and to be able to show them the remarkable difference that I had with it. And so I wore it 15 mLs of oxygen, and I did wear it 24 hours a day. I did not take it off. So this was 2 days post-surgery. I had minimal bruising and no pain. Honestly, 0 to 10, 0 pain. I did not have any pain from the surgery at all. And that was 10 days post-surgery. So staples out, sutures out, 10 days post-surgery, which is pretty amazing. 3 months post-surgery, you can barely see that faint line. I feel like for me, in seeing other people who've had similar surgeries, my scarring is significantly better, quicker with this. Okay, so then my other surgery I had was a pretty intensive abdominoplasty. I had umbilical hernia and diastasis recti. Again, my twins and my 5 children were not nice to my stomach. So I wore the EO2 24 hours a day post-surgery, same, the high level of oxygen, and I had that on continually. And in fact, my surgeon was awesome, and he applied it before he wrapped me and put my binder on and everything else. So it was on immediately after surgery.
Is that 2 different ones?
I did. I had 2 on there just to cover the entire abdominal area.
So you needed
Yeah.
2 of the fuel cells.
I did. Yeah. And I did the same thing on my forehead. However, after having experienced that, I would have done 1 with a larger dressing.
I see.
I had 2 with the smaller dressings, and it was almost just too many cords and things hanging off of me all at once. that I learned after about a week, once I was up and moving around, that I was like, all right, one dressing is easier. Okay, so typically abdominoplasties are pretty intense pain-wise, especially when you're doing muscle repair and everything else. I was off pain meds in 4 days. Did not need them at all, was completely off pain meds. I walked into my post-surgery appointment a week later, and my surgeon actually happened to be in the waiting room and did a double take when I walked in, because I was walking standing up straight, just walked in, and he looks at me and he's like, "Are you being good, Rechelle?" And I was like, "I promise I'm being good. I'm staying in my rocking chair. I'm not moving. I'm being good," because I felt good. So he wanted to make sure I was being good. I had, again, minimal bruising, minimal swelling. My incisions were healing really, really quickly as well. And that was 3 months post. Great collagen stimulation. And you can see my scar down low. Again, it's very, very fine, very thin. I actually just, and I don't have the slides for this, but I actually had to go in for a little bit of a repair. So if you look, there was a little bit of puckering happening. And so he went in and did a little bit of repair there back 1st of January. And my scar from that looks amazing as well. I used EO2 for that as well. And I never even had to take a pain pill for that one. I didn't need it at all. So I think for overall being able to have something that's wearable that you can take with you, that's easy to use from a consumer standpoint, it's not complicated. It's very, very user friendly. The fact that I was able to heal those scars so well. I have patients who had abdominoplasties months before mine, and my scars look significantly better than theirs. So I think that ability to have that full wound healing and that oxygen to create that neocollagenesis is amazing. And then, as you pointed out, the cost effectiveness and ease of it. If you're able to spend thousands and thousands of dollars on surgery, being able to have wound care to maximize those results and to have optimal wound healing, to me is absolutely necessary. Why wouldn't you do that? So I definitely think that having that was a huge part of it. And both of the physicians that saw the results and saw the wound healing afterwards were amazed. Both of them were just like, okay, give me the information on this. I need to look into this a little bit more. So it was good. And I think, this wasn't my case. This was somebody else in the Valley though, who had a vascular occlusion a couple of months after our offices and reached out to me. And so it's not good quality, but I'll see if I can play the video. It was pretty significant vascular occlusion. And so that was 4 days post-injection and then 12 days after EO2. And you can see that healing as well, how much that had improved. All right, that's
Awesome.
all I have.
So I just want to do a brief overview of, because this is always going to be asked, the HBO versus EO2. So HBO, it's 2 to 3 hours out of your day. People that are claustrophobic are going to have problems with it. And there are potential side effects, pneumothorax, barotrauma to the sinuses, and perforated eardrums. So there are some side effects potentially with hyperbarics and EO2 has zero, so that zero side effects. Cost-wise, you're going to be spending in the thousands of dollars for HBO, and this is approximately $80 a day. There was a question about how many different size dressings there are. I don't know that exactly, but it's probably 3 or 4. Dean, do you know how many?
Yeah. Right now we have 3 different sizes available. The 2x2 inch, the 4x5 inch, and the 5x7 inch.
Yeah.
We are coming out with, we had an incision line one specifically for incision lines, a 2x8. But they were so popular, we ran out of them. So we are coming out with a 2x10 here, probably next month.
Perfect.
That'll be available.
And Sarah, you can actually trim them as well, and you don't affect the quality of the device. The other thing that's really important is and Dr. Beals hit on this, is that the oxygen actually goes through the skin with EO2, and with HBO, it actually travels through the bloodstream, the oxygen. But in these vascular occlusion cases, the blood flow is compromised. The other thing is that EO2 potentially is a 24/7 treatment, whereas HBO is going to be, an hour and a half, and maybe you get a little prolonged oxygenation in your blood, but nowhere near 24 hours. So those are a lot of the benefits of EO2. Also, although you couldn't get it on the weekend, it is a 7-day-a-week deal with EO2 once you have it, versus HBO. They rarely do anything on the weekend, so it's 5 days a week if you're lucky. But in certain cities, you can get EO2 the same day if there's a rep that is in your city. She wanted to know about exosomes. Well, I like the Rion exosomes. They're plated, but I think those are the best right now. So Rion, R-I-O-N. There's a couple of questions that I wanted to ask you guys. Does insurance cover this, Dr. Beal? Do you know?
I'm going to ask Dean to help me on this. It does cover it in certain wounds, such as diabetic ankle ulcers, venous ulcers, maybe decubitus ulcers. And Dean, can you expand on what CPT codes are available for this?
Sure, yeah. So we have obviously billed for the what we're designed for, the chronic wounds. For incision lines, we have been attempting to bill, and I think we've been actually reimbursed on 1 or 2 occasions for the incision line, post-surgical, depending upon the insurance company. So private insurance companies on occasion have been paying, but that's something that we are currently pursuing, is trying to get reimbursement for the incision line, as well as the chronic wound.
All right, I'll send this to you, Rechelle, and I think you already answered it, but how quickly do you see the results once you started it for your compromised skin? It's like very quick, 24 hours, right?
For the vascular occlusion, 24 hours later, we saw healing. I mean, remarkable improvement in 24 hours. From the surgical standpoint, initially, I would say it was, I didn't have half of a wound to compare to the other half of the wound. I put it everywhere because I was like, okay, we're going to heal this whole thing. But I think for me, the fact that there wasn't pain and that it healed so well in the long term is where I saw the majority of that benefit. With minimal bruising, like I said, I never got the purple black bruising either in my entire abdominoplasty or on my brow lift. I had no black and blue bruising. It was yellow, green, but never the black blue.
You know what's interesting? Both of you have really hammered home the pain issue, and that is something that EO2 has documented in wound cases as well. So I really believe, and I guess it's not exactly fully understood. There's a complex mechanism of with the pain fibers and so forth, but it really, even that alone is a great benefit.
Yeah, absolutely. And my understanding is that's the tissue, when it has that lack of oxygen, that's that hypoxic state, that's what's causing the pain. And so when you're able to diffuse that through the tissue itself versus relying on the blood flow through the lungs, that is what's helping with that pain receptors.
Yeah, I think it's probably a local mediator that is released by the tissues not getting enough oxygen.
Yeah.
Hold on, there's a couple more questions. My phone. And I think you answered this, Dr. Beal. In your study, it was a 4-day trial with the EO2. Do you feel that longer than that would give even more benefit?
I think so. The example that I showed, you could see that on the treated side of the forehead on the right, it had gone through its slough and its peel, but it was still quite red. not as bad as the untreated side. So I think it could continue to be a benefit if we were to keep going with it.
Okay.
I'll say with our vascular occlusion, our patient had it on for 9 days, with really, I mean, almost complete healing happening at day 6 or 7. But we know that it also increases that tensile strength for the collagen. So if you're able to have neocollagenesis and have even increased collagen formation from these lasers and these things that we're doing specifically for that reason to increase collagen, then that is a great building opportunity that you're able to get that benefit from the CDO.
Right. Another question, is it rented or purchased? At the present time, it's just a rented. And then they give you an envelope and you just slip it in and you put it back in the mail and send it to them when you're done. Really easy to use. How quickly can the device be sent? I can answer that. Basically, if you're in the same larger city that a rep is, that they can often get it to you on the same day. Otherwise, it's FedEx to you the day after. And they're very helpful as far as questions and helping you with the device, but it's really, really straightforward. They have videos. Again, you just wear the fuel cell on your belt, put it in your pocket, and you can ambulate wherever you want. So there's no claustrophobia and there's no restrictions on your movement. How small can the smallest bandage be trimmed and still be functional? Dean,
Yeah,
answer that?
I can actually answer that. So there have been a couple occasions where we actually pulled the tubing out of the dressing and actually applied it just under some Tegaderm, like above a lip or in a small section on a forehead. And so just the tubing itself can be very effective, but it all depends on where it needs to be applied.
Oh, that's an interesting application. I never thought of that one. Okay. So I guess that wraps up all the questions. Again, this has been used for VOs. You were the first, Rechelle. We had proposed it for that purpose, but ever since then, we probably have about 15 people that have used it for this particular purpose. And again, I think it is now the gold standard for vascular occlusions, particularly the ones you can't dissolve, like PMMA, PLLA, and calcium hydroxyapatite. You could put a little hyaluronidase there, but you're not going to remove the filler. So you need to treat the wound. And so the first thing you do is call up EO2, get that thing coming, and then do a little wound care and a little hyaluronidase as well. So that wraps this up. I'm going to turn it back to Kate if she's still there, and she can do the final thoughts.
All right. Well, final thoughts are, thank you, all of you. That was an excellent discussion. I'm sure that based on the comments, people got a lot out of it. So thank you for your time, for the esteemed panel. And thank you everyone for taking some time out of your night and your life to be able to join us for the past hour. We appreciate you. If you would like some more information, you can visit us at eo2.com or visit any one of our social media pages. Thank you to everyone. Take good care.
Thank you, guys.
Thank you. Good night.
Good night.
Thank you.